This conference will now be recorded.
Hi, welcome to Grieving in the Age of COVID-19, our series created and put on by Tabitha Hospice Bereavement. My name is Juanita Steinbachers. I'm one of the coordinators with Tabitha Hospice. I realize in this time of COVID-19 and physical isolation or physical separation, everything is a little bit different, including grief, even though grief is normal and something we have been experiencing for years. But as I said, it's a little bit different and it can complicate things a little bit. For this presentation, I'm talking about complicated grief. Others may term it prolonged grief, just that grief takes longer than it normally would with various factors. We will get into that later, but for now, just thank you for joining us. I hope you learned something. You can always go back and check something or look at, especially at our references that will be given at the end, including our contact information for the bereavement coordinators. Just know that as you're listening to this, it might bring up feelings of your own grief. It might bring tears, it might bring joy. And just be respectful of your grief and others that you are encountering who are grieving, that everyone's grief is unique. So with that said, those are just some of our basics. I want to get into what the basics of grief are. Grief is what you think and feel on the inside after a death occurs. Some of us, this may be our first death we're encountering. Others, it's our fourth or fifth or, innumerable, but it feels different. And that's usually feels different because it's a different type of relationship, or that you have, even if it's another sibling and you've had a sibling die before, it's different because you had a different relationship with them. So grief is different for everyone, and it is the natural response to death or loss in general. For the purpose of this, we are mainly talking about death, loss, but we also grieve other things that we lose and that are no longer in our lives. Mourning is how we express our grief. So grief is what we feel on the inside, and mourning is that outward expression. These are just some very basic definitions for grief that will carry it through and help build later on as we go. There are many different signs of grief. We normally think about the emotional side of grief, emotions such as sadness, apathy, I just don't care anymore, anger at yourself, anger at the person who died, anger at the circumstances around the death, guilt, despair. Those are just a few of those emotional impacts of grief. But we also have a physiological or bodily response to grief as well. That grief affects all of who we are. There's numerous studies that have been shown to say that when we grieve, we have increased inflammation, and that inflammation can impact our daily functioning. We also have grief brain or a foggy brain. Sometimes we don't remember things as well. We don't feel like eating. We may not be sleeping well, either not going to sleep or waking up and not being able to fall back asleep. There are some studies being done on the concept of a broken heart syndrome, where it's a form of heart disease with the same symptoms as a heart attack, but because you are grieving, or just the fact that your heart feels like it is breaking. So there's many more different symptoms, both physically and emotionally, for grief, and then goes into how we interact with others, whether it's family members or coworkers. When you aren't feeling normal, you don't act normal or don't react normal all the time either. All grief is complicated. You know, we want it to be simple, but it isn't. But the truth is, some people's grief is more complicated. It contains a lot of different thoughts, feelings, and behaviors. So it's hard to predict what grief is. It changes. Some people would love for grief to follow these neat little steps or stages. Unfortunately, it doesn't. Sometimes we go forward and sometimes we go back. Sometimes it's not as intense. So that's part of the sense of it. It's evolving and changing. And how we grieve or what we are grieving are affected by other people and events that we can't control. It's affected by how people respond to us. When we feel cared for, our grief seems to be lessened. But yet, if we have a lot of other stressors in our life, like the stressors surrounding COVID-19, we might feel like our grief is so much worse. Even the events around the death or around the funeral, some of those things that we can't always control can make how we process grief more difficult, or sometimes delay it or prolong it. Complicated grief can be strenuous, it can be debilitating. I mentioned that grief brain or grief fog earlier. If it goes on for a long time, it can be debilitating of, I can't function more like this. Many complicated grief symptoms appear in acute grief, but the difference between acute grief and complicated or prolonged is the length of time that the grief continues. Even in acute grief, your daily functioning can be impaired, especially those first couple weeks. But the idea is prolonged grief disorder, that clinical diagnosis, is when it is prolonged. It carries on for a longer time, at least 6 months, depending on who's doing the diagnosing. It might be longer. And it's not to say you might not have normal acute grief at the beginning, but it doesn't start to resolve or change. And then that it can turn into prolonged grief. And while there's certainly factors that can influence it or be risk factors, it doesn't mean that anyone can't experience prolonged grief, and anyone can't do things to try and prevent having prolonged grief or complicated grief. So complicated grief, I have 2 slides here with symptoms, and you need at least 5 of these symptoms to be diagnosed as having complicated or prolonged grief. Wanting to avoid reality. This might be avoiding the reality that the person has died, or it could be other reality, or being unable to face the reality of work or continuing life. Inability to accept the death. Avoidance of triggers and those loss reminders. So a trigger of your grief might be going into their bedroom. A loss reminder might be anything that would remind you of that person on what you lost. So it could be an obvious, if you lost your spouse, a loss reminder is an anniversary. But maybe another loss reminder is not going to the event with someone that you had planned to. You had planned to go to a concert or to go on a vacation, and when that date comes up, it's a loss reminder. Refusal to seek help. An obsessive thinking over the memories or the past, maybe even wanting to live in the memories and past. So while you might, some people might avoid going into a loved one's room, on the opposite side, they might go into the loved one's room and only think about memories with that person. Difficulty functioning in normal life. So if you look at some of these symptoms, it might be a lot like depression. And there is definitely overlap between the symptoms. But in grief, the difference is that grief, the sadness is related to the loss of a person. Depression, it isn't usually related to the loss of a person. It has a different cause. More symptoms include heightened emotions. And then these are all the different emotions that might be heightened. That feeling of emptiness, feeling numb, detached, or meaningless. Suicidal thinking. And if you do have suicidal thinking, please get help. Call the suicide support hotline. You don't have to do it alone. You don't have to be in this alone. And difficulty trusting others. You have confusion about your role in life, feeling that life is unfulfilling, or what are you going to do without that person in your life anymore? The missed days at work or school because of your emotions, these intense bouts of crying. So there's a lot of different symptoms of someone with complicated grief, from someone who is unable to start to transform or adapt to their grief. It seems to them, and maybe to others around them, that grief is dominating their life and that there isn't really an end in sight. Relationship with family and friends start to flounder, and just your general life and what you go about seems jeopardized. So as I said, 5 or more of those symptoms can mean you have complicated grief. Many of those symptoms can be part of acute grief as well. If you feel you have a lot of these symptoms or someone you know does, please reach out, talk to someone. It doesn't mean just because you have those symptoms, you have to deal with it on your own. And some people will have these symptoms and be able to deal with it with a minimum amount of help or in a shorter amount of time than other people, because grief is different. Complicated grief guru Catherine Shearer has a whole program that's multiple sessions. I want to say it's 13, but I'm not 100% sure. So it doesn't mean that just because you have complicated grief and you get help, it will be over with immediately, but there is hope. Risk factors for those who are grieving but may have additional risk factors for complicated grief, that their personality is just more pessimistic or negative. Some people are bubbly and their personality is just naturally different. The type of death, if it's sudden or violent or socially unacceptable, and at least a few of those could be specific to COVID-19, where it's unexpected and a little bit of a stigma around COVID-19. But really, any of these risk factors on this slide would be for anyone, whether or not the death was related to COVID-19. A history of mental health conditions and concerns, a history of substance abuse, and an estranged or complicated relationship with a deceased. So maybe you have some of those, I should have done this, or I could have done more. Or if it's complicated, it might even be the, I'm grateful they're dead, and now I feel guilty for thinking that. So these are risk factors for anyone experiencing complicated grief. Then there's some that might be a little bit more specific to a death due to COVID-19. There might be survivor's guilt, the idea of we both got COVID-19 and they died and I didn't, or I gave COVID-19 to them. So some type of causation, even if you look at it and say, I can't explain why I survived and they didn't, or why I responded medically and they didn't. Survivor's guilt doesn't always have a logical reason, but it does have a valid feeling. Other risk factors are other recent losses. And here especially, I'm saying other recent losses does not mean it was lost due to death. There's a lot of losses that we're experiencing during COVID-19, like the loss of a support system. You don't have all your family and friends around you, that they aren't coming in for the funeral and supporting you. And all of that makes it more difficult to cope with your grief. You may also have the other losses of a job loss or other stressors, or wondering how you're going to do your kids' schooling. You may have disenfranchised grief. This would be for anyone where your grief isn't acknowledged. It doesn't mean you aren't grieving. Maybe you are grieving the loss of an ex-spouse. So therefore, the current spouse or your kids get the focus and the sympathy, but it doesn't mean that you don't have feelings of grief. Or maybe it was the death of someone you were dating. So once again, other family members get the focus, and you may feel like an outsider. That's disenfranchised, but once again, if you aren't allowed to grieve, it can complicate grief. It is estimated that 10 to 20% of bereaved people experience complicated grief symptoms. And this is in normal years without having the pandemic. With COVID-19, these numbers are expected to increase, because you can see how some of those risk factors go up when your loss of support system goes up. When your support system goes down, your other stressors go up, and many other things factor in. You have that increased risk of complicated grief. If you're wondering about stress influences surrounding COVID-19, there is a quiz, a coronavirus anxiety scale. The address is below. And just think about all the stress in our lives that we had before coronavirus. Now we have added stress in our lives, and that is before the death happens. And maybe now that we're several months in, some of that stress feels different, or we've kind of acclimated to it a little bit, but it still doesn't mean we aren't stressed. It's just that our bodies have adjusted to that higher level of stress. So, and our bodies can only continue at a high level of stress for so long. So as we have that higher level of stress, it certainly will affect us in some way. How we grieve might be that way. Other ways that COVID-19 can affect grief is just those instances surrounding the death. That inability to have that final goodbye. I know that some people weren't able to go into the emergency room or into the nursing home or wherever their loved one was dying. This has changed, but not for everyone. It depends facility to facility what their protocol is. And going in for 20 minutes still may not feel like you had enough time to say those final goodbyes. Of course, the changes in the typical funeral rituals, or people being able to travel from out of state to the funeral rituals. It also increases the stress as you're planning that. That fear of the future, if you had a job loss and now you have the loss of a loved one, you're wondering what's happening. How are you going to make it? There's lots of different things that factor into that heightened state of stress and fear of the future. And the loss of our normal social support network due to social distancing regulations. I know that some people have really stepped up and they'll make phone calls, they'll get together on Zoom, that the funerals might be live streamed in some way. And all of those are good and helpful, but it's not always the same as that in-person touch, hug, and eye-to-eye contact. We've also lost some of those distractions, those good things that happen in our life. We have lost some of our rituals. Maybe it's that you can't go to the baseball games because they aren't happening, or maybe they are happening, but you don't feel safe going to the games. So you feel that loss just as strongly. Same with a routine of church. You might not feel ready to go to church yet without your loved one, but it's not an option yet because maybe your church hasn't opened. Or if it has, you don't feel it is safe because you feel you are in a risk category. So we have all kinds of losses about our normal support system. Can't go out to coffee with your friends, or and then the list of what we've lost is endless. And all of that can complicate how you adjust. That not being able to say goodbye, when I was mentioning it earlier, was definitely if you had COVID-19, or even if your loved one was in a nursing facility. But if they had COVID-19, the last time that you were together might have been traumatic. They were being wheeled into the ICU. Or maybe both of you were going in for treatment and you weren't sure what the outcome would be. In some places, and especially early on, before they knew more about the virus, you were unable to view the body. That possible stigma, depending on your area, about, oh, it was a COVID-19 death, where really it doesn't matter how the death occurred. It's still a death, it's still a loss. You're still at the end of the day without your loved one. And as I mentioned before, you can have that survivor's guilt. We do grieve many things, and that increases or influences how we grieve the death of a loved one. However, a lot of those things that we grieve, we often ignore the non-death loss. Moving can be a non-death loss, change of job. But all of those are also heightened, or a few added ones, because of COVID-19. That uncertainty of employment or income, that it's not just you choosing to go somewhere else. The leaving somewhere to go for school, or not being able to go for school, for those who didn't have high school graduation or college graduation, that is a loss. And then even that transition to the next phase, it's a loss because it's a different feeling. You're done with school, but you get to start your first real job. We have a loss of freedom, of being able to go where we want without masks. Some places you have to sign up ahead of time for your spot. We have a loss of social interaction, a loss of those normal ways to grieve or to share condolences. And also a loss of the assumptive world. The assumptive world meaning what we assumed would always be, that we assume that the kids would have been able to graduate high school in May or graduate from college with a normal ceremony. We assume that we would always be able to go about freely, not having to worry about all the etiquette from having masks on or not, when you need to sanitize things around you, when you need to wash your hands. And even feeling safe in your world is part of that assumptive world. That's just a partial list of those things we grieve. And in some ways, those things that add stress. So this list doesn't diminish a loss due to death, but it adds to what we might be grieving, and it adds to how we grieve, or it changes how we grieve. That isn't to say that there isn't hope. Just because you are grieving, just because right now you are feeling like there's nothing else, it doesn't mean that there isn't a hope for later on. Grief is transformed as we adapt to loss. I want to use the word transform or adapt to emphasize the idea that grief isn't something that we go through and we get over, that it's a hurdle we have to climb. Rather, it's something that we have to kind of integrate and transform into our lives. For someone close to us, we will always notice their absence. Sometimes will be more intense, and sometimes it might be a longer time in between times that we think about them. But there will be times when you're going, oh, I wish they were here. Oh, I wish I could share this story with them. And that's okay. That's part of adapting to your loss and integrating it into your life and being able to have those times when it's not intense and painful, but those times of, oh, that would have been nice. They would have enjoyed doing this. They would have enjoyed knowing that their grandkid or who they turned out to be. Your thoughts of the loved one are still present, just maybe not as painful or at the forefront of your mind. And your behavior becomes more connected with life and the new life that you are going to have. I'm not saying that we'll be going back to life as it was before, for we can't go backwards, but we can go forwards and find new purposes and new reasons to live. For people that are experiencing complicated or prolonged grief, this transformation is delayed, but it doesn't mean that that transformation won't happen. It just may mean that right now you're sitting in that stage where you're wondering when. But as I said, it can happen. Not necessarily without work, but it can happen. Some tips. As we might be saying, okay, I've seen the signs, I've seen the risk factors for complicated grief. Now what? How do I deal with it? Well, as with any grief, pay attention to your thoughts and feelings, that it's natural to have varieties and extremes. One way to pay attention to your grief is to keep some type of journal. It might be writing out full sentences and paragraphs about your grief, writing out letters to your loved ones, or it might just be, there's journals out there that are kind of a checkbox. Today I feel angry because. Today I feel sad because. Today was a good day, except for. Realize that you will have those extremes, that you will feel anxiety, shame, anger, guilt. Those are natural and it's okay. Don't judge yourself for feeling those things and don't judge someone else for feeling those things. When we acknowledge them, then we can start to resolve some of those feelings and let them go. And I'm not saying that as soon as you acknowledge them, we won't have that anger anymore. But once you say you're angry, you can do something about that anger. You can look at the anger and say whether it's rational, if you could have done anything about it, and start to process through it. Another tip for grief in general is to allow it to recede sometimes, or to have those times of happy, normal life and sad thinking about your loved one. That it's natural and important to kind of bounce back and forth between the good and the bad. Along with that, know that we all need that break from the pain, that we need to find times to relax, that we need to find times to laugh. And it's okay. Just by laughing, you aren't betraying your loved one. So if you think you or someone else has complicated grief, here are a few steps of what to do now. First, talk to someone. First, talk to friends or family members, yes. But oftentimes your friends or family members aren't going to be able to listen to everything because they also are experiencing their own grief, because they may not have help for you. Not that you can't talk to them, but find someone else to talk to. Talk to someone who is specialized in grief, whether it's a hospice bereavement coordinator, there's other grief specialists, there's licensed counselors, there are groups that do grief share in churches. Talk to someone who has some experience in grief. And you'll find out that you aren't alone in your grief, that what you're thinking and feeling isn't abnormal. Another step is to use positive coping skills, and we'll talk about the positive coping skills in a minute or two. And to realize that you may benefit from multiple approaches. That grief groups, which in some places are often in person, in other places are offered online, which we do have some through Tabitha that are online. Coping skills, counseling, talking with friends, journaling, all those things are things that you can work together to help you go through complicated grief. There also are specific programs out there for dealing with complicated grief and people that are specifically trained in it. Dr. Alan Wolfelt from the Center for Loss is a renowned grief expert, and he says, seeing a skilled and compassionate grief counselor is always a good idea for people who are struggling with grief. But it's an especially good idea for people affected by traumatic type of loss. This does not mean that anything is wrong with you or your grief. On the contrary, it simply means that you are having a normal reaction to an abnormally extreme situation, and so you need extra help. This isn't saying any one situation or another is going to be prolonged or complicated grief, but it is saying that it's okay to reach out for help. Even if you accept that grief is normal and you'll get through it, it's okay. As I mentioned, coping skills. There are those coping skills that aren't so healthy that we often practice that kind of gets us through. But of course, some of those that just get us through aren't really acknowledging the feelings or helping heal, moving through. Eating or drinking or doing things that ignore your feelings or to stuff your feelings, or some of those that we use to get by, but it's not necessarily those healthy coping skills. Here are just a few of the healthy coping skills. I had mentioned journaling earlier, talking or sharing, whether it's with a professional, a group, or your loved ones. And maybe even through some of the grief groups, you'll find one other person who's also going through grief similar to yours, and you'll continue that relationship. Finding comfort in your spiritual community, whether that's going to your pastor or priest or leader for advice, going to scripture, or being able to find comfort in the services. Coping skill, an obvious one, but one we often ignore, is rest. Take extra time to sleep. As our brain and heart are processing grief, it takes a lot of energy, so we do need some extra rest, and it's okay to sleep a little bit longer. Don't forget to hydrate, drink water, stay healthy, eat healthy foods, exercise. I know it sounds like a chore, especially when many days you would rather just stay in bed. But we do have to take care of ourselves so that we have that energy to grieve properly. Create a memory book, a memory quilt, some other, I want to say craft project, but yet some people might create a cross or a memorial marker for out at the grave site or in your yard. And that can be healing. Start or maintain hobbies. Whether it's a hobby you always wanted to do and now you have the time, it was a favorite hobby of theirs, so you want to do it in honor of them, or it's just a hobby that gets you out of the house exercising. Maybe you were never a walker, but now you walk. Some people walk around their town. Some people walk around the cemetery because they feel closer to their loved one at the cemetery. Other people don't feel close to their loved one at the cemetery. They feel close to their loved one in their favorite recliner or in a favorite clothing piece. And that's okay. But find ways to have those hobbies and to not just be in your grief all the time. And another coping skill is appropriate physical touch. Of course, according to physical distancing, social distancing guidelines, but someone that you feel safe with, someone that's in your safety bubble, tell them, I need a hug today. Or I'm feeling tense, can you give me a neck rub? If you feel it is safe in your area, go get a massage or a manicure or a pedicure. That's appropriate physical touch. And even if it's from a stranger, it can still help relieve some of those knotted muscles, the tension, and secrete good endorphins and other serotonin and other things that help you think better and feel better. If you feel you're now living alone and you can't touch anyone near you, well, agree to meet a friend in the park. So at least you can have that eye-to-eye contact and walk together or be at a socially distant, appropriate distance. Consider safely expanding your social bubble. Maybe it was you and your spouse, and now your spouse died. Be taken into your children's social bubble or whatever it takes to still get some, and you can still do it safely. Don't forget that you can cuddle with your pets, that at least is a touch you can do. Bubble baths, finding something like that, that's relaxing as well. And I give this whole list of coping skills, and there's many more. Some of these will work. Sometimes they'll work for you once, but not ever again. And some of them will be your go-tos, and that's fine. And that is because we all grieve differently. We all need different things because our own personalities are different, and the relationships and what we lost with them, the roles that loved one played in our life are different. So as you grieve, here are a few things that you can do. Utilize books, blogs, and websites. I have a few resources listed at the end of this presentation. We certainly have more available in our bereavement offices, but there's other things out there. Even just reading other people's experiences can help. Find friends who are good listeners, but don't forget about counselors or grief groups. If you need to keep busy, that's fine, but allow yourself that downtime too, because you need some downtime to process. If you feel stressed out because of COVID-19 or stressed out about news in general, take a break. It's okay to, not watch news every day, or to say I'm only having 15 minutes of news or 15 minutes of Facebook or whatever it is that's stressing you out. That's okay. Find what works for you and try some of these other things because maybe it will work differently, even if you didn't expect it. A couple of the websites that I will mention are whatsyourgrief.com. They have some blogs and other articles up about grief, and they've been around for several years. And they also have a podcast. Center for Loss, which is Dr. Wolfelt, the quote that I had given earlier. He also has some information there and websites. Of course, you can visit the Tabitha website as well. So in summary, I know I've thrown a lot of things at you. And if you're grieving, you probably don't remember everything, and that's okay. Just know that grief is part of love. As this author said, Jamie Anderson said, grief, I've learned, is really just love. It's all the love you want to give, but cannot. All that unspent love gathers up in the corners of your eyes, the lump in your throat, and in that hollow part of your chest. Grief is just love with no place to go. And it's okay that you are grieving, that you might need help in your grieving and mourning, that you might need that help for expressing or processing your grief. Sometimes in our society, we try not to talk about grief. We only get 3 days of bereavement leave from our work, and we feel that we should be over with it. But because you put so much of your love and yourself into that person, and now you have to find somewhere else for that love to go, it's not a simple process. But grief is part of love. So that concludes our information portion of this. As I said, I'm going to put up some other places to go. So if you need to pause what I'm saying, go ahead from here on out. The Center for Loss was the one website I had mentioned earlier. Complicated Grief is Catherine Shearer. She is a leader in the research about complicated grief. Bridges to Recovery and What is Complicated Grief. Those are both some places that I drew on some information for this presentation. But then there are 2 places that talk a little bit more about handout or have handouts that talk a little bit more about grief. The first one is Coping with Grief During a Global Pandemic. It looks kind of like this. It has a little bit of a picture and a quote, but you can find it online at Hamilton's Funeral Home. And the Grief White Paper series, the address there is at Complicated Grief. It talks about healing milestones and derailers. Derailers are what they term can take normal grief and be derailed into prolonged or complicated grief. So it's a little bit simplified, or at least different terms than what I use today, but it's the same basic idea. So those are some handouts there if you need a little bit more information about complicated grief. And of course, as I mentioned, here is our information with Tabitha Hospice. We have 3 different bereavement coordinators, Abby Henry, myself, Juanita Steinbachers, and Tabitha Hoffman. While we do have our areas we work in, we also are available for anyone to consult us by phone. We have our bereavement@tabitha.org email address that we all 3 can respond to, and also our website. I thank you for joining us, and please, if you feel you have complicated grief or if you feel a loved one does, don't hesitate to reach out. Take care.